Welcome to Cups and Courage, the podcast. Today's guest is Rosie. Rosie is a clinical psychologist working in oncology. And in 2021, she was diagnosed with stage 4 incurable bowel cancer. As of April 2022, she's been in complete remission. Rosie also carries the BRCA gene mutation, and she's had a double mastectomy. Cups and Courage, the podcast. Welcome, Rosie.
Thank you. Thank you for having me.
Thank you for joining us. Thank you. So we have a tradition on Cups and Courage that the guest brings in their favourite biscuit.
Yes.
I know it's in here.
You don't know what it is?
I have no idea what it is.
Are you going to open it?
Yes.
Okay.
You can have one and I'll have one.
Okay. I think you'll be pleased.
Oh, it's a firm favourite.
Yeah, absolutely. It's uncontroversial.
So these are chocolate digestives.
No.
Rosie.
Better.
It's a chocolate hobnob.
The best kind of biscuit. The best
Brilliant.
Kind of biscuit.
They are. That is a solid favourite. Are they your favourite?
They're my absolute favourite. Do you want me to tell you why?
You can do.
Because they are so calorific that if you have a couple of them, they represent a meal. I tend to eat when I'm starving, so if I want a biscuit, I want to be full.
Yeah.
So that's why, yeah.
So that means you stop at about 2.
4.
Right.
Always full.
Great. Rosie, our second tradition we have on the podcast is we ask guests around their own definition of what courage means to them. It's a big theme for us. So I'm handing you the baton. What does courage mean to you?
Mean to me? Okay. So I have two sentences in mind. So the first sentence is facing pain with an open heart. That's my first one. And my second sentence is going through suffering, not around it.
Ooh.
So those two things for me.
Facing pain with an open heart and going through suffering, not around it. I like those.
Good.
I've not heard those before.
Have you not?
No. And there's a really interesting take on it.
It's about dropping the struggle and dropping the resistance to what's uncomfortable and what deeply disturbs us. I think that's fearless.
Thank you. So while we're on the topic of courage, are you happy to give us a little overview? You know, tell us a bit about yourself.
Sure.
Who is Rosie?
Yes, I can do that.
Thank you.
So I'm going to start with my age. I'm 41, nearly 42. I'm married. I've got 2 young daughters. So that's my sort of domestic arrangements, if you like. I'm a clinical psychologist. I qualified about 12 years ago, and I worked in adult mental health for about 10 years. And in 2021, in the springtime, I was diagnosed with stage 4 incurable bowel cancer. But after lots of chemotherapy and after some surgeries, I went into remission officially in the following year, so spring 22. So that was a huge thing in my life, obviously, and something very unexpected to come along. And we might talk about a bit of that, perhaps as our conversation goes on. There was a lot of pain in all of that, but there was also lots of learning and lots of lessons. And one of the things that it brought me really close to were existential concerns that I think we all have. So, for example, things about death, meaning, what's the point of all of this life, our inherent isolation, some of those themes I was really, really up close to. And I was thinking about, in my life, when I got better, what perhaps needed to be different. And one of the things that felt needed to be different was maybe where I was working, because what I really wanted to do was explore some of those themes, those existential themes, in my work and with conversations with people that were also in that space. And so I took a bit of a punt, to be totally honest, and I thought that working in oncology, in psycho-oncology, would be where that could happen. So I started to work in a cancer psychology service at Great Western in Swindon in the September of 2023, and I've been there ever since, and it is a complete joy, and I'm really committed to that work, and I've loved it. I've really loved it.
So it's a punt that's worked out, actually.
It was either a really inspired choice, or I thought it might be total madness, to be honest. I did not know. I felt in my heart it was going to be the right thing to do, so I decided to just go with it. So I've been doing that and loved it. And last year I have the BRCA2 gene, so I went for a regular kind of standard surveillance mammogram, and they found DCIS, which is a sort of pre-invasive cancer, I think. And they said, right, well, let's give you a mastectomy. I'd always wanted one, having known that I'd had the BRCA gene for a few years. So that's what I did last year. So I had a mastectomy last year. And then I, just to complete all that surgical process for the BRCA gene, I'm having ovaries out this year, November time. So that's a little bit about my lived experience and my professional background.
Thank you.
Yeah.
So the mastectomies, because of the BRCA gene, they are risk reducing.
They are risk reducing. They were risk reducing, yes, with the slight complication of the fact that it seemed to be that something was developing.
Of course, because of the DCIS. Of course.
So
of course.
So nobody was going to say you have to have it at that point, but it felt as though it was perhaps sensible.
And your surgical choice after mastectomies?
Yeah, so I decided to have a flat closure for a number of different reasons, really. The first reason was that, I initially, when I had thought about having a mastectomy, I thought I would just be reconstructed, and that it would be like going into some kind of aesthetics clinic on my lunch hour and just coming out better than I went in. So this was my complete naivety about it all. So I thought there's no problem with any of this, and I wonder if that was slightly defensive. But anyway, I was met by a surgeon at a hospital, and she said, no, it's not like that. She said, because of my frame, there's a good chance of complications in terms of the aesthetic of it, in terms of like rippling and things like that with the implant that I was thinking I would go down that route. And so it really caused me to have a second think about that. And the fact that it's not always, but often isn't it a one-stop operation, that you might need to go and have other procedures subsequently. And I have had so much surgery that actually those two things combined made me just think I might just not. And so I decided to go flat, and the surgeon that I eventually saw, she really made me think about, are you sure? One of the difficulties with that question, of course, is that, well, no. How can you possibly know what the right thing to do is? But again, I sort of thought, I'm just going to sort of trust maybe my intuition and take a punt and fingers crossed and see what happens and see if it feels okay.
So that's the surgeon initially, when you said, this is going to be a lunchtime situation, we're just going to sort it out and move on. They said, no, if we choose to reconstruct it, there's going to be potentially some complications, some other things. So at that point, she,
yeah.
Did she give you kind of, these are your options, what's available to you? She did.
Yeah, she gave me the options.
Yeah.
For me, tissue-based reconstruction wasn't appropriate or possible because I have a lot of scarring, like abdominal scarring. So it was implant. It was an implant. There's other types of tissue you could take from other places, but I felt it was too much compromising many muscles in a way. So I decided that it would be implant. But then she started talking about like a mesh underneath to hold the implant, and it all felt quite involved. And I suppose over the course of the sort of bowel cancer stuff, that I was quite used to pain and discomfort. I sort of had enough, and I didn't necessarily want to go through too much more. And actually, she was really good. She said, a lot of people have had a lot of surgery decide not to, and she actually, what she did was she actually presented going flat as a real option and as a real choice.
Wow. Okay.
Whereas the thought of that prior to talking with her and thinking it through, it was never even in my mind. It was only when she said, it's not going to be a panacea for you. It's not going to be like just swapping like for like.
Yeah.
She said, they might be cold, they might feel heavy, some of that sort of stuff. And then I went away and did a bit of research, and I thought, it might not be it might not cover the loss that might come with its own issues.
Yeah.
That said, I know there are a lot of women, especially I see in my work, that have really good experiences. We've all got different body shapes, types. My chest's quite lean, and there's not much fat there, and so that would have perhaps made more of a problem with the aesthetic. But there's lots of women that opt for that choice. It looks great, and they're really happy with it. So it's very, very individual.
Can we jump over then? Let's go. Firstly, I didn't say thank you for sharing that so succinctly, because I am acutely aware that's years worth of experience, and there's lots of things that we've almost just gone, wrapped up. Bit of that. For the purpose of this, I'm acutely aware that there's a lot of stuff that, that comes with those experiences. So I'm acknowledging that, because I just went straight in on the, please. The mastectomy choices and those things. Let's move just briefly over into your clinical side of it. When you are working with women who are, I suppose, facing similar decisions, what's the input that you have? When do you come into play for a female going through a breast cancer journey?
So I do, as part of my role, sort of risk-reducing mastectomy assessments, which is kind of part of the pathway for that. And so we will see people who maybe have got like the BRCA gene, or a gene that makes them highly susceptible to breast cancer. I might also see women that have perhaps had breast cancer in one breast and had that breast removed, but then want like symmetrizing surgery. So I might see people that are in that situation. And so, so my job really is to provide a reflective space to think through all of these things that I've been talking about that come with a mastectomy, So, what brought you to your decision? What's the background to that? How did people react? What have you been told about your options, complications, risks? How have you coped in life with big challenges before? What support's around you? So that's kind of the things that we look to sort of to just reflect on, really, and to get to people to have that space to consider all of that before making that choice. And
that comes into play with risk reducing, though. That doesn't come into play for someone who go, you've got we're going to have a double, or we're going to have a single, or this is it, and there's no I suppose want to have symmetry, or take healthy tissue, that's when it comes in.
So if somebody that's received a diagnosis of breast cancer, they might be told, we need to give you a mastectomy, often say like unilateral, they won't take healthy tissue, then people wouldn't see me. I don't, that's not my experience.
Absolutely. Understand. Okay. And those that see you, do you see I suppose, how many of those reconstruct versus how many stay flat? Like, what's your experience? Do you?
My personal experience, which is perhaps not representative, but just mine, is that most people, the vast majority, reconstruct. So either tissue based or with an implant. I can probably count on one hand. I've been working there for a couple of years. I only work 2 days a week, so but I can probably count on one hand the number of people that decided to go flat. So that would be the dominant choice. That would be the dominant choice.
And then coming back to your own decision then to go flat, I know largely because of the influencing factors and just more information really around it. What's life like for you as someone who manoeuvres through the world without boobs?
Well, if I'm going to be totally honest, when they came to remove them, I was disappointed with them by that point in my life. They'd fed children and they'd lost their glory. And so when I woke up from surgery, I felt a bit more streamlined.
I love that.
Right? Like I've got quite an athletic build. I felt just a little bit more like a panther. I don't know. Maybe I'm a bit of a one-off, but it didn't get in my way terribly. And I'm quite sporty, so I've quite enjoyed not being kind of constricted with a sports bra that feels kind of vice-like. I don't wear any kind of prosthesis or anything else like that. I don't feel particularly conscious of it. But I also am aware that maybe that's an unusual response. And maybe I'm more identified with a body that is slightly more androgynous. Maybe I'm quite comfortable in that space. Maybe, for somebody else, the signifiers of womanhood feel very, very important. And I've, of course, got others. Like I've got pink nails, I've got long hair, and so we all find our femininity in different ways. But I was quite prepared to leave that particular signifier in the past. They also came to represent something to me that was quite dangerous. And I think having had the experience with bowel cancer, I was keen to not have those reminders of something that could happen that was dangerous again. So my saying goodbye to them was relatively unconflicted. Of course, that's not to say that in other areas and times of my life, I have been conflicted and distressed about body image. You know, I've got a lot of abdominal scars. You know, one of my abs, it doesn't really work because they've cut nerves and things. But and so it's, you know, that terrain is not easy. But I've tried to honour my experience by going, you know, when I look in the mirror, I think, okay. So I try and say a very conscious okay to it all, really.
Thank you. I'm listening because a lot of what you're saying I can really relate to as well, and this concept of what your breasts signify for you as a female. You know, what that is really interesting. Because you're right, it's not the same for everybody. No,
it really isn't. And I've worked with patients, and you know, I will touch on my lived experience where I feel it's relevant, if I feel it might be helpful. But one of the times I probably wouldn't is if I'm working with someone who said, and actually this was a recent encounter for me, a patient, you know, was working with me, she said, I could never go flat. It would be the absolute worst thing. It would be stripping me of my womanhood. I couldn't bear it. Of course, then I you know, I would not, I would certainly keep my experience back, because what is of primacy is everybody's individual voice. But we have all of us as prone to such different conditioning, so many different identifications, and we're all such fingerprints, so unique. So there is just as many experiences as there are the people that have mastectomies, I think.
How often do you find yourself in those spaces, either when we're talking about those existential elements, or around the aesthetic, you know, and the psychological impact of that? How often do you find yourself almost your lived experience coming up? Because obviously these are different hats you've got on.
Yes, yeah.
And so, how much is influenced? How much is your lived experience influencing your professional?
That's a really good question. And it's really, really hard to answer. Because it's really, really hard to sort of quantify and sort of... I think that my lived experience is the absolute foundation to the work that I do, and the position that I come from, and the conversations that I generate. And then, of course, there is all of the theory that I know about, so like cognitive behavioural therapy, existential psychotherapy. There's ideas that I'm aware of in all of that put a name to some of the things I might have experienced quite succinctly. Like, for example, you know, like I said earlier about, you know, confrontation with mortality, isolation, meaning and things. But it's almost like what comes first is that felt sense of what this journey's like. And then I can use some of these other concepts and bits of my understanding to give it a name and to take it further, and to provide things like skills or techniques or things like that. But I would say that experience comes first.
I think, and I can imagine that actually, because of how you went into it. It was an intentional choice off the back of lived experience as an evolution to, you know, your profession.
Yes, yeah.
Are you ever in front of people that change your perception on some of those key areas? You ever sat with someone and it makes you think differently about your own experiences? Does it, you know, do you turn it back on yourself at all?
Well, so for example, with that patient that I mentioned earlier that said I could never go flat, it would be like a decimation of womanhood. You know, that is a poignant confrontation with the choice that I made, and causes me to sort of reach deeply within and say, well, okay, we're all entitled to a different conception of what womanhood is, and to own my own truth and authenticity. So for example, sometimes when, you know, people might say things I completely align with, but when they don't, it really, you know, and when they have a different experience, it causes me to say, okay, that's really interesting how rich we're so different, and also what's mine. So we can, you know, hers is her, mine is mine, you know. So I feel like everyone I speak to gives me a different facet of cancer, you know. I mean, because I work with people across the board, so all different types of cancers, all ages, all stages. And some of the fears, for example, in maybe something like lung cancer, wouldn't be the same as I've experienced. Some of the real challenges of sort of like a cancer in the brain, for example, I haven't faced that. So I'm constantly learning. So my voice and experience in terms of cancer is tiny. Do you know what I mean?
I hear that when we're talking about the breadth of cancer and then the breadth of people and those nuances that they're faced.
So I'm kind of humble in the face of it, making no assumptions at knowing the full story at all. And that keeps it fresh. You know, it would be very presumptuous of me to make any assumptions on a wider scale than just mine. I'm genuinely interested in how people are navigating this life challenging and often life-threatening, sometimes life-limiting condition. It's humbling.
Those three areas that you talked about. So you're talking about mortality, isolation, and meaning. You know, those are three that come across through all types of cancer? Are those the three dominant?
Yeah, because I read this the other day, which really interested me, and it was something about whatever stage cancer you've been diagnosed with, you're confronting your mortality. It actually doesn't matter. So it's not the people with advanced cancer are doing it necessarily more than people with like a curable stage 1, for example. And that was really interesting to me. So that kind of confrontation with mortality is very, very present and often manifests as a fear of recurrence.
Yes.
You know? And so that's one of the reasons why that's sort of one of the most common reasons for the referrals that we get, is because people are frightened, you know. And also there's this sense of, you know, in terms of meaning, when people, you know, perhaps they get better, and then it's like, well, what now? What is the point of all the new priorities? But then how to actualize that? Still feeling a bit stuck maybe in something of the past. So real dilemmas at that point. And then isolation. You know, one of the things that people describe when they're going through cancer and its treatment is this profound sense of being alone, facing your mortality, for example, perhaps, in a way that nobody else can do for you or with you. They can support you, but it's you that has to face your own death. And it's you that has to turn up for chemotherapy. And it's you that has to say yes to the IV lines. And no one else can do that. And it's profoundly isolating. It really is. Maybe that's my experience. But I think that often does come through.
Beforehand, obviously, when you were working in psychology, what was the area that you were working in? What did you have? There are two questions to that part. You know, what was the area, and did you have a construct of those three kind of existential pieces back then, or has this really been something that's come into its own when working in the oncology space? So
that before I was working in sort of psychiatry, so adult mental health, and so a lot of trauma, a lot of early trauma, that was a heavy focus of the work, leading to sort of really long-term problems, sometimes with managing feelings and relationships and things like that. So that was the very, very dominant focus. Health stuff didn't really come into it. If anybody had cancer, they were, you know, they'd access the service that I work in now. But it was kind of, my sense was it was kind of an add-on rather than a
integrated in.
Yes. So the two areas were seen as somewhat kind of a little bit distinct. And in terms of but to answer the second question, I have never really come into contact with anything existential before cancer. Absolutely no idea. The truth of it is before I was told about this BRCA2 gene about 3 or 4 months before the bowel cancer diagnosis, so not long.
How did that come about?
My dad had prostate cancer, and so it came through some family correspondence that this was a thing, she should get tested. I was very happy to get tested, and then I was told that if it was to come back that had it was 85% chance of having breast cancer, which floored me a bit, because then I realised that we weren't mucking about here. That caused me to think about mortality. But prior to that, the truth of it is, like for most people, I understood that death happens, but I didn't think it was going to happen to me. Yeah, it's going to happen to everyone else, right? I'm just like special, no? You know, that kind of thing. So it was a real confrontation, you know, it was a real confrontation with that great leveller that is the fact that we're all going to die. And I really had to take that on board. And then I'd reconciled myself to the fact that actually that was okay, because someone was going to tell me, worst case, that I might get I was very likely to get cancer, but they were going to stop that from happening. So I was like, phew, actually, let's look for the silver lining. And then 3 months later, a doctor said, no, actually, you have got cancer and you're not going to get through this. And that was a bit of a whiplash moment. Yeah.
You're here.
Yes. Yes.
Let's go back to your own personal experience from the stage 4 diagnosis and everything leading up to, around healthcare, around what that was for you and what choices you were given. Were there decisions that you had to make? I imagine with a stage 4, things are pretty imminent actually, and there are some real clear directives about what needs to happen when it needs to happen. How much of that do you feel throughout your journey you were sitting in the driving seat for, and how much of it you know, were in this space where you were just receiving and absolutely just getting your head down and putting one foot in front of the other?
Yeah, I would say that because of the nature of it, and at the point of being diagnosed, soon after, the month that followed, there was kind of had some complications in terms of the area of the bowel around the tumour started to perforate, and there was emergency surgery to kind of stop that from being quite as lethal as it so often is. And because of all that sort of drama and emergency, there was this sense of I was being completely bombarded with what was going to happen to me. And it in a sense, there didn't feel like there was any place for choice or independence of mind. I was being fed through a machine. And I very much understand that. And I was in a place of devastation and surrender. So that was okay. But what I noticed was feeling deeply ashamed and defective and broken. You know, I'd had this body that I had come to value as being one that was a reliable vessel that would carry me into old age, and suddenly somebody told me that I had the complete wrong idea and it was very, very broken. So I also felt tremendous guilt because I had 2 very young children. So they're still young, they're not quite as young, and I couldn't believe that I was bringing this upon them and shattering their family. So when I arrived at oncology appointments, it was very much shuffling, head down, with people saying, we're here for an oncology appointment. Patient's name's Rosie Howell, so family. She's here to see XYZ, you know. And so I found it very hard to even look people in the eyes when I had to make that kind of announcement that this was who I am and I'm here to see an oncologist. I couldn't even believe it. And but something happened to me when I came out of hospital, so 6 weeks after being diagnosed. And it was a really difficult experience being in hospital. And I was overjoyed to be at home. And I started to think, okay, so this is my path that I am on. I can't get off it. And I'm going to have to stand a bit straighter because I can't stand the indignity of it. And maybe that's ego, maybe that's pride, but I thought I'm going to have to start owning this. So what I started to do was notice that I would walk into these appointments and say who I was and who I was there to see, stand up a bit straighter. I would also do things like with nurses and oncologists, I would start to play a little bit, maybe have a joke, you know, just find my zest a little bit. And so that turned it around a bit for me. And then kind of, 6 months later when, for example, we were talking about different chemotherapy regimens and drugs and should we keep this in or should we not, kind of questions. Then I found myself going, well, this is actually what we're going to do. And I think I don't want to do that. And I went away and Googled it before AI, this was. Yeah. Went away and Googled it and said, well, I'm not sure. No, I think let's play it safe and keep everything that we've done. Let's not make any changes. And all of that kind of stuff. So I certainly found myself going from a position of kind of crumpled shame to, okay, so this is me, you know. And if I've got cancer and it's of this nature, I'm going to wear it well. I'm going to do my very best with it.
I'm going to be part of the conversation.
Yeah. And I'm also not going to... I was washing my hands one day. I remember this really clearly. And there's a voice in my head. I don't think it was it wasn't a voice outside my head. It was a voice in my head, right? And it said, I will not let cancer take my spirit. I will not let it do that. And there was another point where I was sitting on a meditation cushion just watching my breath because that was really useful to me. And there was a voice in my head and I was thinking about chemotherapy and it said to me, because I was struggling a bit, I was like, I don't want more of it. I don't want more of it. And the voice said, this is the life you've been given. This is the life you've been given. And I thought, yes, I just have to do it.
What do you think that voice was?
I think it was some kind of inner intuition and just coming back to just some, I don't know if it was a figure in the past, but some strength, some guidance that in moments of kind of falling apart. And it's not always been there, but just at some moments it came through strongly, and I was very grateful.
I'd be interested to know if other people have experienced those moments as well. I have, those kind of inner voices, which yes, might be intuition, and they could be, who knows what they are. Who knows? But they seemingly come in quite unannounced and sometimes unexpected.
Yes.
And you can give a name to them. It doesn't matter what it is. It's the thing that provides you maybe clarity or direction, or that thing that reminds you that you might be on your own. It is isolating, but there is that inner piece that's, Yes,
the relationship with yourself.
Yeah.
And actually, I think that was such a resource for me. And other times in my life where I've noticed that fall away, that's when life gets really tough. When you stop having a sense of there being an ally in the inside, maybe you're under like a lot of confusion or conflict, or I don't know. When that disappears, it's really, really hard. And I've certainly been there. But at some key moments, I managed to find an ally, and I was very encouraged by that.
I've not heard it like in those terms, and I think that's really helpful because it makes the intangible a little bit more graspable.
Yeah.
If someone was listening, and I suppose using your lived experience personally and professionally, how does one find the ally within?
I think that so often at times of struggle, we can be beset by quite a critical voice. I think very many people experience that that narrative or that dialogue. Oh, you're not so good at this. Why can't you just do this? Why can't you be better at chemotherapy? Why can't you have not done this? Why didn't you go to the GP sooner? Why, all of that kind of stuff. And so I think maybe that can stand in the way so much of our, of other voices within us that are encouraging and compassionate, So I think perhaps maybe the first step is to just notice what holds us back from connecting with that kind of inner ally and that inner goodness. And so maybe it's something as simple as, if you hear a voice that's trying to bring you down, to recognize it for what it is, which is, okay, this is actually just a thought. This is memories. These are old stories. I respect that they have a place there. They're part of my life and my experiences, but I'm not going to let them run the show. So maybe just working on self-compassion can be quite a useful first step. And just recognizing sometimes those things that stand in their way as just being thoughts, I think.
I think my own experience, everything was so fast-paced at times, which is probably a bit of a contradiction because also there was so much waiting, right? Yes. But maybe internally very fast-paced. And so actually trying to slow it down internally and not jump a million miles ahead just to, to keep bringing me back. And I think it's giving that inner voice a purpose. Giving them a job to do. Yes,
and giving them room so that you giving yourself a sense of internal space so you can hear all the voices, because there are the voices that we hear that hold us back and can be critical, but there are these other voices that can be encouraging. And maybe like what I was talking about, sitting on a meditation cushion, just that simple practice of sitting down quietly with your eyes closed and following the breath, the physical sensations of breathing in and out. What you'll notice is that there are thoughts that come and maybe raise feelings of anxiety, but there is also spaces where there aren't thoughts, and those spaces can be quite restful. And so to just observe the mind rather than getting really, really caught up with the stories it tells us, I think can be quite useful. Yeah,
definitely. So the evolution of Rosie's advocacy, or the voice, that inner voice from I suppose those initial days until 6 weeks down, where you're actually really part of an active conversation and coming with your own research and questions and curiosity, which I know you've got a natural propensity for, that curiosity as well. What happened afterwards? Did that just continue? Because I see you today and you're probably the most colourful person I've ever met. Okay, literally, I love it. But I wouldn't have necessarily thought that you would Okay. I was going to say, been a quiet observer of those initial kind of steps. I wouldn't know that. I think that's what trauma does to us, right?
Yes.
We're just kind of blindsided sometimes.
Yes.
But have you felt that you've stepped into this space and it's kind of propelled you forward, or is this who you always were and cancer sideswept you? And
so my experience of me is being, I don't know if anybody else has this experience of them, but just that we are constantly shifting and evolving. And when I think over periods of my life and other periods, like what's bothered me, what's interested me, I experience myself as quite a different person from decade to decade, year to year. So this is kind of the sort of the iteration of me now, and I'm no doubt that it will give way to other things. This me is not a me of 5 or 10 years ago.
Okay.
So the me of 5 or 10 years ago was incredibly interested in perhaps achieving, ambition, fitting in. And one of the things for me that cancer did was it ripped me out of all of that. So it stripped away things that actually I came to realise I didn't want to run my life around. So, for example, conforming is one of those things. And I think it's sort of related to that is the experience of probably particularly all the surgeries was despite the best efforts of everybody involved, it's incredibly dehumanizing. So you go in, you're stripped of your clothes, you're given a number, not a name, on your wrist that you're not allowed to take off, that kind of thing. And I really, really wanted to not be that, I think, to have a sense of my own stamp, my own authenticity. And also because I experienced myself fading out of life in terms of becoming iller and iller and iller, I think there's probably a part of me that wants not to be faded. So some of these things are a response to cancer, I'm no doubt. But I don't think that makes them wrong.
Or any less authentic. Yep.
I think cancer's come along, given me a bit of a shake, and caused me to really reflect on how I want to move forward in the next bit of my life. And it's something about being fully me. And, it's not always easy to do that. We have responsibility. Society tells us certain things about what, women should do, or our roles, or how we should behave. So I'm not saying it's conflict free, but it's definitely something to aspire to. That's where I am now. Yeah.
I think having that lived experience in your back pocket, you can never get rid of it. It's
never.
with you. So actually, you just need to. For me, I sometimes pull it out for my not memory, because it doesn't ever go, but it's to remind me of the shape of everything else that's going on.
Yes.
When you life. I suppose having a curveball like that where it is all encompassing and actually that curveball changes shape because you're granted a new lease of life, for today.
Yeah.
And then the environment changes. You're a busy mum, you're working, you're dealing with other people's, curveballs. Sometimes, I know for me, I can normalise. It can get very normal, which means I can make something that's not very stressful very quickly until I remember that really that's not a big thing at all, is it? Really, we know what the opposite. Yeah.
So interesting, isn't it? That actually, even going through something kind of life-changing, devastating, we still get caught, we still get stuck, and I've actually been really interested in that. When I was very, very ill, you would look on at like sort of normal people and think, how are you getting yourself bothered about that? Yeah. Right? Now I'm getting bothered about that.
Yeah. Yeah.
So we're all of the nature to, we're all human and we're all of the nature to get things out of proportion, to be devastated, and everything in between. And one of the things I really emphasize at work is that we're all of the same stuff. And so if I, for example, share my experience in a small way with people, it is a nod to our shared humanity. All of our bodies are of the nature to fall apart, and our minds at different times. And there's nothing really that divides us in terms of that. And so I come to my work not in the position of someone that knows or some kind of expert, but just in someone that is willing to share in all of this, the disaster of it all, which is how it feels very often, and to offer some companionship along that path, because often what people say is, I can't talk about this stuff with my family because I feel guilty for bringing it upon them. I need them to be strong. Some of this stuff we make up in our own heads, right? But sometimes it can also be true.
Yeah.
And so having a space that is neutral is a real lifeline to people. An unpressured space to just begin a conversation a bit like this, actually.
But it is, I think it's one of those conversations that's not granted freely. You know, I think, you know, I've shared this recently. It was only off our conversation that made me speak to my team and say, actually, you know, what would one need to do to be able to access support, quite specific support around those key elements that you talk about relating to cancer, which isn't the same as, you know, therapy, generic therapy or counselling.
There are some specific considerations.
And it's almost a shame that it's not there's not the funding. I know this is not the conversation, but it's a shame that it isn't granted as part of an intervention throughout, regardless of the I suppose the triggers that you hit in those conversations, because there's lots of people that mask and lots of people that put on a brave face and actually behave in a certain way in a fight and flight space, but actually when they go home, those fears are the same, you know, and our mechanisms. And I think the value that comes from just connection, and not feeling like a burden, feeling heard, and not trying to be fixed. Yeah, absolutely. Because it is learning how to maneuver and navigate through life that is forever changed. Yeah, absolutely. And to find yourself in this new space, you know, to the sense of being ripped out of life as you once knew it. I never knew before having cancer that this is so naive. But, you know, the hospital, you know, of a Wednesday, people having chemotherapy all day, right? Yeah. A completely different world. And all of a sudden, every other Tuesday, I am there with a trolley full of God knows what, thinking, wow, I should be at work. Yeah, yeah. You know, it absolutely mind-blowing. Because it completely disrupts what feels to be normal and predictable. Yeah, absolutely. All your constructs of what life looks like and what your environment is. But you know what? I do wonder if that's if you can, for me personally, if that was one of the interesting gifts. Yeah. Because we have this view of our life that we subscribe to, that it has to comprise of X, Y, and Z. And suddenly someone goes, nah, actually, right? Rip it up. It's now this. Yeah. And you think, oh, okay, maybe more is up for grabs than I thought. And so in this era that I'm moving into, like for nearly 42, I suppose I am very much with thinking about, I guess the future's mine to author a bit. And so there have been some things, I feel like with the experience of cancer, that it is uncontroversially awful. You can. I know you were going to use bad language then. I could feel it, and you held back. I am of that nature to do that. So, but also, like with anything, if you look closely and experience, there are also pockets that are not so bad. And I certainly felt that my tendency to savour and appreciate certain things that I would have taken for granted, it's a bit of a cliche, but were there, and more so, and then also some of these learnings that could very helpfully go on to shape my future life were there if I looked for them. So that was useful, that was helpful. Yeah. And that has spawned this. I love this. Thank you. Yeah, I similar in terms of stripping back those constructs, but the roots of the person that exists in that space are the roots of the person that exists in the other space. Yes, absolutely. And so for me, instead of anchoring to what happens on a Monday, what happens on a Wednesday, what do we do in August, what are we having, it's going, okay, well, I'm anchoring into those values actually that are really important to me, the principles that are really important to me in life. And you're right, the rest is up for grabs for today. Yes, you know, that's right. But it's I think it's an ebb and flow of life. Yeah, absolutely. Yeah. Did you have support when you were going through this from a psychological perspective? Do you know what? I didn't. And so I was in therapy actually at the time of being diagnosed, and I got out of therapy quite quickly after being diagnosed. And the reason was because I didn't want to sit and think about it, to be totally honest. I didn't want to think about how hard it was, and I didn't want someone being sympathetic because I had so much of that. And it's quite hard not to be sympathetic for when somebody who's quite young gets quite a serious cancer.
And the therapist was absolutely brilliant, but I just didn't want to think.
Mm.
I thought I had a year left, and I just wanted to go out and walk in the countryside and be with my kids and try and fill them up with as much of me as possible. And I didn't want to be in a room away from them. So I wanted to be rooted into my immediate surroundings. The other reason I think for not doing therapy or having some sort of support of that nature was because I was still struggling with deep feelings of shame. Okay. And I didn't want to be pitied or connect with a sense of being in need in any way. So there may well have been a defensive maneuver as well. I was getting pity from every angle. Everybody I was at a meeting was either sort of scared to talk to me or would tilt their head and ask me, or to say that I looked well, but in a way that suggested I didn't.
Yeah.
And I was sick of it. I just wanted to be normal. I wanted to occupy as much of life outside of that in a space where I wasn't in need as I could. And another thing that was difficult, I think, was I remember, perhaps very understandably, coming into contact with, say for example, I'd been put with someone like me, a therapist like me. I felt really envious of well bodies, and I assumed that everybody else I met had one. And I didn't want to be too close, perhaps, with a therapist that was with a well body. I just felt too inferior. I don't know if that makes any sense.
Yeah, I get it.
But I just wanted to, I think, probably be strong. And that probably meant not being vulnerable a bit. And now I can see that. And now I can see that it couldn't have been any other way.
Yeah.
But there was probably a bit of a rigid attachment to stoicism.
Do you think that makes you now a really effective support function because you have lived that for other people?
How do you mean?
So if people are coming to you and talking about those, fears, those places where actually it's okay to be really vulnerable. Yeah. It's okay to talk about the things, because you have been on the other side of it where actually you haven't as well. And you have done that brave face. Yeah. It's meant that the empathy and love that you have for yourself, that comes out when you're working with other people.
It's an interesting question. I think that there's been a bit of an evolution in terms of that front, that what has happened for me is that there was such stoicism, there was such soldiering on, and then there's been a point more recently where I have come to terms with the fact that I might have been successfully treated and have a future, and that takes a while to sort of take, if you like, I think for me. And I think because of that, coming to that point, I have been able to let go some of that rigid holding a bit and come into contact with something that actually has felt quite vulnerable. And it has asked me firmly to take notice of it and to yield. And I have done, and I found real wisdom in it, real reaching out. And I've connected with what feels very vulnerable. And I think that has probably given me the most appreciation for how important it is to, as I said at the beginning, to lean into what's difficult. And so in terms of courage, that idea of an open heart and going, through what's difficult, it's what I aspire to. I can't always say that I have been courageous in that way. Maybe I've been a bit defensive at times, but also we do our best.
We do our best.
We do whatever we need to at the time for the family structure that we're surrounded by, what treatment we're going through. We do what we need to do. But I do think that facing the vulnerability, even if it's been walled off a little bit, is just magic, even though it's very, very painful.
Thank you for bringing it back into that courage piece, because I would also add that the courage takes loads of different shapes and forms.
Yes.
Right, in that time, in those times with the kids when you just wanted to get out walking, huge amounts of courage through pain. So I don't think it's. I think we can be courageous and afraid. Do you know what I mean? I think the two can coexist, because I think we can.
No, I absolutely think that's right. And you can notice, isn't it, even as I'm talking, perhaps a quickness of being an ability to judge. We all do that. And I think sometimes courage is sort of, perhaps at times, like zipping yourself up and having that general anaesthetic and hoping that everything's okay. It does come in different forms. There's an interesting quote from something called compassion-focused therapy, which I think is quite useful for thinking about how we react to things. And it's broadly something like, given what you know about yourself now, and also about your history and everything that's made you, your temperament, your environment, does it make sense that you feel the way you do? And the answer to that question is always yes. And so whatever stage of life we're at, whatever choice we make, there is real logic there. That doesn't mean that we can't pivot when things are safer. And often we see patients after treatment because there is this sense of, well, what now? And I'm on safe shore, and maybe I can let in some of this sense of vulnerability and a real reckoning with what happened. So there's no right or wrong way to do it. Yeah, that's our key message, I think.
I've loved this conversation, and thank you. It's been really great to talk around the professional side of it as well, that psychological aspect. But also thank you for sharing your own lived experience. You're someone who's walked through the fire and continues to do good in that space for other people. And so thank you so much. And thank you for the chocolate
You're
hobnobs.
so welcome. I might just eat mine in a minute.
We're going to. Thank you, Rosie. Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.